You're listening to In Sickness, a podcast about caregiving with Allison Breininger and Justin Bima. Good morning, Allison.
Hey, Justin. How are you?
I'm doing pretty good. I had a birthday yesterday and
Happy
was able
birthday.
to, thank you, get out and do some fun stuff outside. So, yeah, it's been a good couple days.
Good.
Yeah.
Good. Glad to hear it.
Yeah. How about you? How are things going over there?
Things are actually all right.
Good.
You know, I can't remember if I told you last time, but Sean had this procedure a week or two ago, and now he's going to have another one in a couple weeks. I don't know. So we had a pretty quiet week without procedures and
good.
Are just kind of trying to enjoy that and just kind of hunkering down with the cold and the dark and all of that. So
right. Yes.
Yes. But I want to just get past the chit chat because we have a guest here today that I am excited to introduce. So we are so grateful to have with us today, Dr. Vaida Kazlauskaite. How'd I do? Did I do okay? As a person with a complicated last name, I get it. She's a medical family therapist who works with clients who are diagnosed with medical illness and are experiencing hardship in their relationships and just sort of life in general. She specializes in communication about the illness and how to best cope with the mental implications. She has a doctoral degree in family social science and is an assistant professor at UNLV, teaching and supervising students. So thank you so much for joining us this morning on the In Sickness podcast. We're really glad you're here.
Thank you for having me. I'm excited to be here.
Good.
Great. I was wondering, can you share with us what kind of led you to pursue this field of study and work? How did you end up doing this?
Yeah, great question. So actually, when I was 15, I lost my dad to cancer. My parents had already been divorced, and my mom has been happily remarried already. Loved my family, loved my stepdad, except for my dad didn't tell my parents until very late. And then we as in my sister and I, we didn't get told about the diagnosis until a few months after my parents found out. And then unfortunately, I think we found out in December. I went to see him in the summer. He was back in Europe in Lithuania. And then unfortunately, he passed away 6 months later in January of 2007. So then I don't think it really hit me what happened until I started college and I started thinking, what am I going to do with my life? How am I going to make money? What is this career I'm going to pick that everybody's talking about? And my friends are like, you're really good at talking to people. So I decided to major in psychology. And I think like any other psychology major, I didn't realize that you need to go to grad school to do anything with the psychology major. So about my junior year, I decided to kind of get into, or at least start looking at grad schools. And I found this brilliant program, marriage and family therapy at UNLV. And I was like, hey, this is something I could do. And so I started this program right after I graduated with my bachelor's. And during this program, I actually recognized this gap in research that no one's actually looking at what happens when parents get sick and how do they communicate that to their school-aged children, right? So anywhere between 6 and 18, they're in school, they're starting to understand things, but how do you tell your child that a parent is really, really sick or they may be dying? How do you do that, right? So I was like, this is it. This is my passion. So I started researching it at UNLV. After I graduated, I decided to apply for PhD programs, and I ended up at University of Minnesota and worked on my PhD and really got into this work even deeper and understood more of the gap. And here I am.
Can when you did that, and if this is too personal of a question, of course you can always pass, but what was it like? Because you said, how old were you when all of that happened with your dad?
Yeah, I was 14, 15 when my dad passed away. I was 15. Yeah.
Okay. And so as you started digging in and doing this research, what was that like for you personally to think about, to sort of compare and think about how that had shown up in your own life and what your family had or had not done?
I think it was both difficult, but also it justified what I wanted to do, right? Because I started talking to people and it seemed like everybody had a similar experience where my master's thesis, I found out that I talked to kids, well, they were adults, but I talked to them about their experience with ill parents as a kid. And they felt left out. They felt not included in the medical system and the medical decisions. And so they just felt left out. And I was like, there you go. This is what I experienced. So I'm like, I have to do this work. So it was kind of like, I think it helped me process my dad's death as well. But then it just kind of told me like, this is the path. This is where you are supposed to be.
And when you say left out, do you mean like the doctors and the system left them out, or the family members left them out, or both?
Mainly the medical system and a little bit of the parents. So the parents, when they were talking about being left out, it sounded more of a protective factor, right? Or not knowing factor. So the parents wanted to protect the kid and didn't tell them everything, right? So there was none of my participants back then did not know about the diagnosis. So they all knew that their parents were ill, but how much they knew depended on the parent. But the big thing was when they were in the hospitals or any clinical setting with their parent, they were completely ignored. The doctors didn't even make eye contact with these kids, which I think it talks about how kids are seen as children and not autonomous human beings, right? And so the doctors, of course, are going to ignore them because that's Western society's thoughts about children. So I think it highlights that, hey, if they're in the room, we need to address them. We need to acknowledge them. We need to see if they have any questions, because kids always have questions.
We talk on this podcast a lot about the ring theory and about, the person who has the diagnosis is in the middle of the ring. And then we as caregivers are the second ring. And so we talk a lot about how we, even in the second ring, are ignored. And so obviously we're not children, but I think that what I have found, I'll say from my own personal experience, is that the doctors are focused on, they're like, my job is for this patient. It's not for ring 2. It's certainly not for ring 3, 4, 5, 6, right? So I think it's, even though I'm not a child, they're ignoring me because I'm not the person on their caseload, right? And so, on this podcast, we're so often focused on ring 2, but I'm excited today because I think that to talk about like, what about those other rings, those 3, 4, 5s, and so whether that is kids like you've been talking about, but also I think, I think about my parents who moved across country to be here. They live 5 minutes from us to help. And, my mom especially then ends up being my caregiver. Like she is in it with us, but people don't really see her. Right. And so, or, the siblings of the kids, like if there's a child who has an illness, but then it's their sibling, the siblings who are healthy. And so one thing you've mentioned already is like feeling left out, but what are other sort of impacts on these other inner ring folks besides feeling left out?
I think the question is, how are they not affected? I think in every way, everybody in that first ring, right? And not to get too educational, but we do have a theory from Brofenbrenner, and he talks about the micro, meso, macro circles, essentially. So it's the same thing, right? So who's in that first circle and how is it affecting? So I think an illness can affect everything from as minute to everyday routines to meals to who's the caregiver of the children now if a parent is sick, right? If you are getting that extra help, right? So who is in that circle and how are they being affected? Not what is being affected, right? Because I think the entire, anybody or anything that is in that first circle is most certainly going to be affected in every single way.
And when you're saying circle, you mean sort of the family unit, right? We usually are saying like the first circle is the person. We're thinking of like rings like a bullseye, but you're saying sort of like the family unit, right?
Yeah.
Okay.
Exactly.
So thinking about children specifically, what can adults do to talk with children about what's happening, what may happen, et cetera, and how does that kind of vary by age of the child?
Yeah, I mean, developmentally, the age really is important, right? I think what you would tell a 7-year-old is not what you would tell a 12 or even an 18-year-old, right? So we have to remember kind of where are they developmentally? And I always tell parents when they say, how do I tell my kids X, Y, and Z? I always say, refer back to another difficult conversation you may have had in the past. So if a grandparent died, a pet died, or something happened, maybe not died, but somebody got ill, how did you tell them, right? Because it's easier, of course, to talk about other people than yourself. So then when it comes time to talk about yourself, always, always, always start with a calm manner, right? So if you plan on doing it on Sunday morning and you wake up and you and your partner or whoever's involved is not feeling well, throw it out. Choose another day when you feel fine and comfortable, right? Because our children are going to pick up our emotions, our thoughts, kind of, they will know if something is wrong. So if you start a conversation on edge and nervous, they will immediately become on edge and nervous. It's really important to kind of start with a calm self. And then I think it's really important to be honest in a direct way, but not in a scary way, right? So if you are talking to a younger child, maybe using less medical talk and more about, mom is sick or dad is XYZ, and here's what's going to happen, and this is what it looks like, right? And kids, again, they strive off of structure and routine. So you want to make sure that they understand how it's going to impact them. So yes, dad is sick, and that means he's going to have to be, quit his job. What does that look like? Now dad's going to be home. And if the kid is still not in school and they're at home, now dad and the kid will be at home together more. That's different. It's exciting, of course, but that is different, right? So explaining these minute changes that you may not think is a big deal, but really kind of explaining everything in detail. And then lastly, I think it's important to always, especially with the younger kiddos, to talk about how it's not something that they did. It's not their fault. This is something that happened to the parent by no wrongdoing of the parent either, right? We have all these like blames and stigmas around different illnesses and different behaviors. We say, well, they did that, so of course they got sick. We want to make sure that we talk about none of those things, because when a person gets ill, it's not somebody's fault, right? Anybody's fault. It just happens. And so making sure that the kid knows that, mom, dad, I did nothing wrong. I'm still very much loved, and we will get through this together.
Oh, this is so good. I'm just like, I'm just sort of entranced listening to this, wishing I had had this conversation with you like 13 years ago. So thank you so much for this.
Thank you. Yeah.
So speaking of that, my daughter was 4 when my husband was diagnosed, and is now 17. And so I've sort of tried her whole life, have tried to navigate this piece. And so I was thinking about, when you said the thing about like, you wake up on that Sunday morning and you're just not feeling it because cancel the conversation because you want to go into a calm. And so I think, a couple balances that I have always tried to find is like, I don't want her to feel worried if she sees me upset, but I also want her to see that, especially as she's older, that it's healthy for me to show my emotions, because if she just thinks, oh, mom's going through this really hard thing, but she's always fine, I guess I should always be fine. Right. So a two-parter here, I guess. One is, or let's just start there. So how do we sort of balance the showing our emotions enough that so they can see it's healthy and mentally healthy people show their emotions, but not so much that it scares them. Does that make sense?
Yeah. Yeah, absolutely. And I think, Allison, you said that great word. It's all about balance, right? So if you are scared, if you are feeling like you need a day to just cry, that's okay. Your kid should see you having emotions because you are going through a hard thing. The key word again is balance. It's maybe don't let them see you every single time you are crying, especially if it is every day, right? Nothing wrong with crying every day. I'm sure I cry a lot, right? But making sure that they don't see that every single time. And then the other tricky emotions are, right, we often see people who are diagnosed with anything that's out of their control, right, which is often they get angry and frustrated with themselves and life and things like that. And that anger, frustration, whatever's coming out is a great emotion. It's important to feel it, but it's important not to let it out on your children, even your partner, right? But we're talking about your children. It's important to not yell at them because you feel angry, right? You can express to your kid that you're feeling angry about these things, and this is how I feel, and this is making me feel angry. But again, making sure that they don't feel like they're at fault or that they did something wrong, and then now you're in a bad mood because of them, right? So emotions are great, but maybe even labeling them and talking about them to your kid instead of letting them out onto your kid.
Yeah. Yeah. So the second part of that with the balance is I've always tried to figure out how to involve her, but not, I want to be really careful about her not feeling like she is a caregiver. Mm-hmm. Right. I want her to be a kid, but I also don't like you. The very first thing you said today was be feeling left out. You know, so we've tried to do things like when she was 4 or 5 and my husband had a bone marrow transplant, like he was in the hospital, he was still doing okay. And so we had her help put on these little hospital sticky socks, you know, or when she was like 10 or 12, we had her help hook up like the feeding tube. Right. So it's more about like, this is kind of cool that you get to do these medical. Do you want to try this or not? You know, but I want to be really careful because I don't want her to feel like she's a caregiver. And so how do where is that balance between involvement, but not having them take on this role that is a really kind of like grown up role that we don't necessarily want them to have?
Yeah, exactly. In my world, we would say we don't want to parentify the children, right? Because that's very dangerous and has so many long-term impacts. But again, this is not going to be a one size fits all. But I think it's very important to have those conversations about how much do you want to be involved, right? Depending on the attachment that the child has with the sick parent, depending on their own personality and characteristics, they may want to do everything with you guys. Or they may say, you know what, I think you guys got it because you guys are great parents. I don't think you need my help, right? So you said you asked your daughter, like, do you want to be involved? That's a great question. I think, again, seeing our children as autonomous human beings is really important. They'll know if they want to help or they don't want to help. So asking, of course, not a 6-year-old, but maybe like you said, 12, 14-year-old, hey, we're doing this today. Do you want to be part of it? Totally okay if you don't want to be. Totally okay if you do. Whatever you decide is best for you. And never pushing them into, hey, we're doing this and you're going, right? Because nobody likes to not have choices, including children. So having that conversation. If you feel like they always say, yes, I want to be involved for whatever reason, and you see that it's hard for them, let's have a conversation about that, right? I see you're really wanting to help us and we really appreciate and love you for that. But how's it feeling for you, right? Just because they are doing it, just because they are involved doesn't mean that they're happy. So we got to make sure that we are checking in with their emotions as well.
Oh, that's so good. So good. Yeah.
Jumping back to the ring theory a little bit here. The premise of the ring theory is it's, people comfort in and then you dump stuff out to outer rings. But kind of as we're talking here, there's kind of pieces bringing up in ways where we need to support people in the rings that are outside of us. As we kind of think of, maybe things are more of a web than they are clearly delineated rings. So how do we kind of mentally and logistically balance being like in it as the person who is like right at the center, while also kind of thinking of caring for the others around us who are also impacted and going through these hard times?
That's a really tough question. And as you were asking it, I was thinking, first and foremost, I think people need to identify who is in what circle, right? Who is your support system? Who is part of that? And sometimes it's not even a person. Sometimes it might be groups. Sometimes it might be things. Sometimes it might be places. So identifying so that you know who's taking care of me as a sick person. So who's in that first ring? Who's in that third ring? And how do I take care of them while I'm also trying to take care of myself, both physically and mentally? So again, not a one size fits all, but I think it's important I think it's hard, right? Because if you are the sick person, how do you check in on the people who are taking care of you? But it's important to recognize that it is affecting them in whatever ways. So making sure that they feel supported. And I don't think that you as a sick person may be in the place to provide that support, but there are support groups. There are like this podcast, right? Like there are so many infinite amount of resources that the people in the outside circles need to know about. So I'm not sure whose responsibility that is to find out, right? I don't know if it's all on the sick person. Maybe it's a team sport, right? Because as you guys know, caregiving is doesn't happen in a vacuum. You're getting so much help from every angle, hopefully, right? So same thing for those people. How is there a support group for caregivers? Is there a great resource like a book that can provide you maybe some comfort and some emotional intelligence? what are the resources and how do we access them? I think that's important to identify. I think that's the logistics of it, right? The emotional piece is, do we have a check-in? Maybe we could schedule a check-in once a month, every quarter, whatever feels comfortable, to check in on each other. And this is not the time to be focusing on the ill person, because that happens every time. This is the time we're really only going to focus on the people who are taking care of me. And bringing those people together, maybe even introducing them, right? Maybe you have a friend that brings you soup every other week and they've never met your parents who are always there. So introducing them to one another and making sure that they establish some sort of relationship so that they can be that support system for one another.
I love that idea, because I know that there are people who are like in ring 3 and they're like, well, I know I can't dump on ring 2 because they're in it too, but nobody else understands. Right. I have friends, but they're not in it with me. Right. And so to sort of introduce the other like rings 3, 4, and 5, right? If they're if they're your supporters, so that they can sort of say like, oh, I was there today and he looked pretty bad and that was really rough. What did you see? What did you think? So that's not being dumped on the primary caregiver, but that they still have people who are kind of in it that they can talk with. Yeah.
Yeah.
You know, we often hear, because Justin and I are both spousal caregivers, that's a lot of what we focus on. But we also have lots of listeners who are caring for children with special needs or caring for parents or elders. And so how do you see those? You know, we talk a lot here about like how spousal caregiving can impact marriage, but how can caring for being a caregiver for your kids or your elders impact marriage or relationships?
Yeah. In every way, again, right? I think that they're going to be impacted depending on what is happening. The relationship will be impacted a lot of the times, again, and not to overuse this word, but if you are taking care of your sick child, your sick mother, how much are you going to pay attention to your relationship and how much are you going to pay attention to the patient, right? So we forget to date. We forget to take care of our partner's needs. We start to neglect them, and that's not good, right? So we have to make sure that we are, again, balancing. We, of course, have to take care of the ill person, but we also have to take care and nurture ourselves and our relationships. Because at the end of the day, you're really going to need those relationships. You're going to need your spouse. You're going to need your partner to help you through these things, right? Physically, emotionally, mentally, spiritually, in all those ways, you're going to rely on your partner. So let's not neglect your partner so that when you do need them, right? Have date night, go out and talk about anything other than being a caregiver. I know that's harder said than done.
Right.
I realize that, right? It's like telling a parent not to worry. You're always going to worry.
Yeah.
But try your hardest, your conscious effort into talking about the movies, the weather, anything, right? Just getting away from your reality, your norm, really keeping that spark alive between the two of you.
Yeah, it's interesting. We did a couple episodes ago, we interviewed someone about physical intimacy. And I was really thinking about that in terms of spousal caregivers, but I was surprised, and shouldn't have been, but about when we had the support group and when people responded to the podcast, how many people who are caring for kids or caring for parents were like, yes, absolutely. This caregiving role, even if it's not with their partner, impacted their physical intimacy with their partner just because of this extra role that they had on their plate. And so that was a perspective that I had overlooked until then. Yeah. You know, when you and I were chatting the other day, you shared with me a really sort of troubling statistic about a research around like the suicide rates of the siblings of the people who are impacted with illness. Can you share about that with the group, with us?
Yeah, absolutely. So I'm actually looking at pediatric oncology patients, so children with cancer, and those who have healthy siblings are actually at a higher risk for suicidal ideation and depression and anxiety. Because again, the parents are going to be very focused on the ill child and maybe not so much on the healthy child. And that's scary to think about, right? Because the world doesn't stop. Again, it unfortunately continues to go at a very rapid pace. So you have to make sure that you are focusing on both children, especially if you are dealing with a child who has cancer, right? That's very scary. You obviously don't want your child to go through that, but all the children in the household are going through it, right? Not just the diagnosed one. So we absolutely have to intentionally make sure that we are paying attention to those healthy siblings.
Hmm. So, kind of continuing on talking about kids a little bit here, we often hear phrases like "kids are resilient." Is that accurate, or is that something that we're saying to kind of try to make ourselves feel better about the difficult situations that these kids are put into? Or, I mean, maybe that applies to people of any age as well. But can you talk about that a little bit?
Mm-hmm. I think that kids are resilient is an interesting statement because why do they have to be resilient? Because they're being put in a situation, in a position where they have to be resilient. They don't know anything else but to keep going, to continue. But just because they're resilient and they seem fine doesn't mean that they're fine, right? Physically, sure, they're okay. They're still going to school. Maybe they're even still doing well in school. But how are they feeling? Is that resiliency going inside? So, again, making sure that we are checking in with them, providing them the resources, providing them therapy, providing them support groups so that they can feel like they are being taken care of, so that they don't have to be resilient by themselves. I think when we were talking about resilience, it's the same thing as adults. I don't know how I feel about when people tell me I'm resilient because of all the things I've been through. What does that even mean, right? Does it give me a compliment, or does it put extra pressure on me to not break down and to not give myself the time to just have a mental health day and cry in bed all day?
Totally.
So,
Yes.
right? So same
Yes.
thing with
Yes.
kids. Are we putting on pressure saying you have to be resilient, or are we saying, hey, you are resilient. You're doing a great job at handling whatever's going on, but how are you really doing? Do you need anything? So I think it can be all at the same time, right? Resilience, but we got to make sure that they are actually feeling like resilient is a good word for them, and that they're actually feeling like they're doing a great job navigating whatever is going on.
I feel like I've heard both with sort of kids who have behavior stuff, but are also illnesses, that sometimes the other kids can therefore sort of read the room and realize like, oh, I have to be perfectly behaved, right? There's a lot going on in this house. Therefore, I need to sort of, and so sometimes I hear parents who are like, wow, like they're so well behaved. And I think this is probably true of my own child. I'm like, that, wow, she's doing so well. When in reality, is that more just like, okay, I am putting myself in a little box because I realize like there is no space in this home for me to have needs. You know what I mean? Do you see that a lot?
Yeah.
Is that a reality?
Yeah. And that's so sad, right? If you are living in a household where your child thinks there's no space for me, what kind of adult are they going to grow up to be?
Yeah.
Right?
Totally.
Are they going to be a person with healthy boundaries who won't take anything from anyone, or are they going to be a people pleaser, right? We don't want either one. We want, again, a balance. We want that to be in between. So again, making sure that we provide them that space, that physical, but also that mental space to say, I am feeling ignored. I am feeling like this is really, really hard, or whatever's going on, right? But giving them the space for it and saying, you are important. Yes, there's a million things going on in the house right now, and we're trying to navigate this new diagnosis, but you still matter. You are still important, and your feelings still matter. And if you are angry about it, that's okay. You are allowed to feel whatever you are feeling, but talk to us, talk to anybody. Don't just keep it inside.
Yeah.
Kind of similar, tangential to that, I guess, with talking about kids being resilient or something. I think we here really don't want to put like silver linings on things or try to bright side people with,
Sure.
this is happening, but also, what about this or but this? But with going through difficult things like this, whether it's kids or people of any age, like, is there a benefit to experiencing and going through those, not to diminish the hardship or see it as giving the hardship purpose, but in the end, is there benefit to having experienced those things?
That's a really tough question. I want to say yes, but that's because that's the type of person I am, right? Because again, I made a career out of what happened to me when I was an adolescent and with my dad's death. But that doesn't mean that everybody does. My sister, for example, she loved my dad, had this similar experience, not the same, but a similar experience, of course. And she's not in the mental health field, right? But that doesn't mean that she's not benefiting from it in other ways. Did it make her a stronger person, perhaps? Maybe. Maybe it made her more, again, resilient. Maybe we got taught at an early age that people get sick and people die, and you now, are not, kids always think that they are going to live forever, right? They don't really know about death until something happens. So now they know, hey, I have to be more careful in my own actions. I shouldn't run across the street because I can die, right? I think there's a lot of benefits. There can be benefits, but it doesn't have to be. And I think if there isn't a benefit, that doesn't mean that you're a broken person or something happened there and you failed. You went through a hard thing and now it sucked and it was hard and it made you angry and bitter. And now you have to live with this pain for the rest of your life, right? That's not a benefit. That's quite the opposite.
Yeah, right.
Right. So it's so hard to answer that question because I think it is what you make of it, but it really depends on your own personality, your own characteristics, and how you navigate difficult things in your life.
Yeah. We've talked a lot about kids, but, so for, Justin lives with his in-laws and like I said, my parents are close by. And so both of our sets of parents are pretty integral in our lives. Right. And so what do you think about sort of the impact on the other adults? And I think in some ways people are quick to say to me, well, what about your daughter? Like, how is she doing? But I don't know that people would say like, what about your parents? Like, how are they doing? Even though they are very much in it and impacted. And so what do you sort of see about sort of that next layer of adults that are around, but that aren't like the primary caregiver? So therefore they don't really get sort of the acknowledgement and the recognition and how this impacts them.
Yeah, I think that's a great question because do we even know that they exist, right? Do we know that, for example, you guys as parents moved closer to be with you guys so that they can help?
Right.
Do people know that? Because that's not, not everybody has opportunities to do so. So maybe your friends don't even know the sacrifices that the other adults in your life made. And it doesn't even have to be you guys as parents, right? It might be your siblings, it might be your cousins, it might be any adult that is helping out. So again, first and foremost, identifying that these people are in your world, that they are supporting you in being a caregiver. And then on the other flip side is like making sure yourself, right? Like, hey, mom, hey, dad, I know that you basically dropped everything to help me and we appreciate it. But is there something that you guys need? Again, having that intentional conversation is very important. Is there something that you guys need? Is there something that I can do differently or better to support you in supporting me so that they don't feel like they, sacrificed everything for nothing? And when I say that, I don't mean like nothing, because of course it's a beautiful thing to be able to help out. But it's like, I am still my own person and I have, needs and wants. And then it's also important to tell all the adults to have, again, my favorite word, boundaries, those healthy boundaries. So yes, your parents moved to be closer to be able to assist you. But does that mean that they're at your beck and call for 24/7? No, right? They may have bad days too. They may have days where they don't feel well physically, mentally, and that's okay. And saying, hey, I need a day to myself. And then, of course, you guys have to be okay with that too, right? Like, oh man, I was really counting on you today, but it's okay. I will handle it. I will lean on my other support system, or maybe we can push back whatever I wanted to do today. So boundaries are important.
Yeah. Because I think about that logistically, but also even I think about the emotional toll. I think back to when my husband had his bone marrow transplant, his brother was his donor. And so you think about all the family systems involved there, right? Yeah. And so his brother went through surgery. Wow. And we didn't really give him, we were very grateful to him, but all attention at that moment, right, was on my husband. But he just went through this really intense thing. And so you think about his wife and then their parents and, all of the rings and rings and rings and rings. Exactly. So he's going through surgery and watching his brother go through this thing. And And so I think about those two a lot, my brother-in-law, sister-in-law, and my parents, and how they are the ones that, like, when there's an emergency, boom, they're there too to support us. But they're also witnessing these really hard things, you know, and they're also going through them. And people aren't, you know, I don't know if how well they're being checked on or how well they're being able to process, because they're really good at the ring theory. So they're not dumping on me. They're comforting me. But they also just went through this really hard thing. You know, and so I think we just want to expand, you know, we're so good on this podcast about shining light on ring 2, but I really hope this conversation can help us start to shine light on rings 3 and 4 and 5, you know, or and whatever that looks like, in that there are other extra layers of caregivers as well.
Yeah, absolutely. I mean, back to that, like you mentioned, your husband's brother helped out and had surgery. How did that surgery impact his marriage, right? Was he bedridden for maybe a few days, and how did that impact his wife? If they had kids, what kind of conversations did they have with the kids? Because hey, dad is going into surgery. Surgery is scary, right? So what we got to make sure that everybody, like you said, in each circle feels heard, validated, and supported.
Yeah, the ripple effects for sure. Yeah.
Yeah.
What do you think about, like, the medical system? Like, you know, early on you said something about how, like, the medical system just ignores the kids, you know, and we think that they often ignore us as caregivers as well. Like, what do you think that the medical system can be doing better to support the other rings?
Now you're talking about my beautiful dissertation.
Well, perfect. I didn't even know I was throwing that ball right to you. Perfect.
Yeah. So it's tough because I think we look at medical doctors and we want them to be our heroes, and we want them to acknowledge everything and do everything correctly. And we sometimes maybe forget that they're human too, that maybe they are overworked and they only have so much time with each patient. Not to use that as an excuse, because it cannot continue to be the way it is, which is that caregivers, children, anybody but the patient is really being ignored in the caregiving room, right? So who can do this job? Who can provide that extra support? Who can take those extra minutes to talk to people who are in the room with the patient? Is it a nurse? Is it a medical family therapist? Is it a chaplain, right? What are the resources available? And how can we connect the patient and their family members to those resources? And now on the flip side, my dissertation found that medical providers are not actually being trained to communicate with anybody but the patient. And even with the patient, it's a very minimal training, right? So maybe this is kind of my end all career goal, is improving the training that medical providers get during their 4 years of, medical school and then residency, and then having those continued educations. They all do. They have to take continuing education credits. Make sure that communication is one of them, because it's so important that we learn, we as providers, that we learn that we need to be talking to everybody in the room, not just the patient. So it's slow, but it is happening. We are seeing a little bit of shifts, right? We now have care navigators who check in on patients, and that's not happening across the nation, but I know there are places that have those people.
Sure. We interviewed a palliative care physician on this podcast, and something that I just think about all the time is that he says that essentially a huge part of his palliative care training was that he went for an extra year to learn how to, communicate and be nice and have those like more sensitive conversations and to see the whole family. I was like, wait a minute. Like, not everybody gets that. Like, you had to go for an extra year for that. Like, that's terrible. Back to what you said at the very beginning about them ignoring the kids. I think a piece of it is not just like the lack of autonomy. It's that they're probably scared of the kids. Because what if they say, hey, little one, how are you feeling about this? And then the kid replies. And then this doctor who's not trained in kids is going to be like, I don't know how to answer that. They almost, I think, prefer to not even ask.
Absolutely.
They don't know how to respond to the kids. Like, that's not their area.
Yeah, absolutely.
There's pretend they're not even there.
Yeah, there are a lot of studies, especially on nurses, who say that their hesitancy to talk to the patient's family, the patient's kids, is due to that fear, right? What if I say something and make it worse? What if I say something and open up a can of worms? And I'm not trying to do this. Yeah. So we hopefully as a system, we're going to be moving into this integrated healthcare model where everybody's there in one building, right? We have the medical doctors, we have the nurses, we have the techs, and we have the mental health professionals. So that way, if that door is opened and the kid, the partner, the spouse, whatever, has a breakdown and wants to talk, let's go next door to, this therapist, which is right here. You don't have to make an appointment next week. You don't have to go anywhere else. It's right there. But that's an idealistic future. And again, we are working towards it, but it's still far away.
Yeah.
When you say we, do you mean UNLV or we, your profession? Like who's working at it? Because I want it today.
Yes, it is the profession, right? It is the profession of caregiving. It's the profession of the medical and mental health field. For example, my program, the Couple and Family Therapy program at UNLV, is actually housed in the School of Medicine. So we're starting to see that the bio people are thinking the mental health people need to be in the same place. Yes. We're starting to see that buy-in, right? We are all important. Physical health is nothing without mental health and vice versa. And we're starting to see that professionals are seeing that importance and starting that integrative work. So it's happening at the university level, but it's also happening at the bigger level of like hospitals and other medical settings.
Great.
All right. Keep doing it. We need it.
Thanks. Thank you.
This has been really great conversation so far. Is there anything that we didn't cover that you would like to share regarding your thoughts on kind of these topics or the work that you do or anything around that?
No, I think you guys asked really great questions. I think the only thing I'll add is that, again, checking in on whoever's affected by the illness, by the patient, by the sick person, but also understanding that it's okay not to be okay. And we need to say that to people, that we don't always have to be strong. We don't always have to be on point. We don't always have to be the, savior and happy person and the person that's always there for everybody. Sometimes the person who's there for everybody needs somebody too. So making sure that we really intentionally check in on one another, right? And that goes back to the patient too. Yes, they're struggling with a lot. Yes, they are dealing with physical and mental pain, but there are other identities to that person. They're not just a patient. They are a spouse, they're a parent, they're a child, right? And making sure that they can act towards those roles too. So again, when we are feeling like, Allison, you mentioned that you had a week without procedures, maybe that's a week we can have date night, right? And if we can't leave the house because of whatever reason, because it's cold or because they're not up for it or because they don't feel well enough, let's have date night at home, right? Let's make it fun. Let's act to our other roles besides being the patient and the caregiver.
Yeah. So we always end with sort of a call out to our supporters. And so people who are listening, who are maybe not caregivers or who are caregivers, but are supporting other people in their lives. And so and this is, I think, for all three of us to maybe answer, but what are the ways that we think that supporters can show up? Today, we're talking about maybe it's for the kids of the family or the parents or the rings 3, 4, 5, the other people in the family. How can others... So maybe this is rings 6, 7, 8, 9, 10. How can those folks show up for rings 3, 4, 5? Any thoughts on that?
Whatever feels right, I would say, right? So if it is a quick phone call to check in how they're doing, quick phone call to see what they need, quick text message. Hey, I know, this is still going on. I know I have a busy life myself. The holidays are coming. Everybody's stressed, but how can I support you? Because sometimes we don't know. And I think people are afraid to just say, how can I support you? Because people feel like we need to know. And if we don't know, we're bad friends, we're bad caregivers, we're bad whatever. That's not true, right? Let's just simply ask them, because what I need as the caregiver in ring 2 or 3 might be the person in ring 5, 6, 7, 8 might not even know, because how can they know if they've never had a similar experience, if they have never dealt with that, they might not know, and that's okay. So just asking, like, what do you need and how can I be supportive?
Mm-hmm. Mm-hmm. Yeah. I'm thinking about my mom and how, you know, the integral role she plays. And I know she says everywhere she goes, people say, how is Sean? Right. And so, you know, and then people are starting to learn. So they're starting to also say, how's Allison? But what I also want her people to start saying is, how are you? This must be a lot for you that you are living close by. You're witnessing this every day. You're helping this family. How is that impacting you? So I mean, I would say to supporters, I start seeing sort of the extra rings and start checking in on them and asking them, like, how does it impact you to witness and support a family in this way? The other thing I was thinking about is having, you know, with my daughter, I always say, like, you don't have to talk. I don't have to be the person you tell your stuff to. I just want to make sure you have somebody in your life that you talk to. Because again, she might be, and I think she is, like, protective of me. Right. And not want to be like, doesn't want to put another thing on mom's plate. And so if you're a person in the life of, and there's kids around, and you feel like you can be that safe person, or you can just be another loving adult to show up at their Christmas plays or their whatever, right? Because I think there's lots of years that we have not been able to go to the things or do the things. And so this sort of like community of friends who have like shown up to be extra adults for her, both in those sort of ways, like having people in the audience, but also in the like, hey, let me take you out for breakfast. And, you know, so that she knows, you know, okay, if I can't, if mom's doesn't have the capacity right now and dad doesn't have the capacity right now, I've got these other loving adults in my life that can be there for me.
Exactly. Again, feeling like I have the support if and when I need it.
Yep.
Yeah. And I think even similar to that, like if you have a friend whose spouse is caring for their parents, make time for your friend there who doesn't have as much capacity to spend time with his spouse as, you know, they would like, but make sure that they get time and attention as well in their lives. You know, certainly that applies to kids in your lives that are in these kind of situations, but I think there's adults too that would benefit from, you know, focus on supporting them as they're also impacted by this.
Absolutely. I mean, we're human beings who want and need attention, right?
Yeah.
So it's nice when somebody checks in on us. It's nice when somebody and says, hey, I recognize you. I see you. And I see maybe that you're struggling, or I see that this is really hard for you. Like, being recognized is just a human need.
Yeah. And I think that too often people who are caring for their parents, it's just like, well, of course, that's what you're doing. And nobody's stopping to be like, that must be hard. Can I take you out for this? Can I check on it? You know, or same thing with kids with special needs. Well, you're just parenting. And so I think shining light on and recognizing, like, this is extra. This is a lot that you're doing. And I see that, I recognize, I honor it, and I'm here to support you.
Absolutely. Yeah.
Oh, this has been such a good conversation.
Yeah.
I'm already like excited to re-listen to it. I've got some notes I was taking over here, and listeners, you know, we'll have a support group on this, because I know that there will be lots of rich conversation that will come from all of you after you've heard. But Vaida, thank you for first of all, for being here with us, but also for the work that you're doing. I mean, I'm sorry that these hard things have happened to you in your life. And I appreciate that, the work that you're doing out there. And it's always inspiring to hear when you're like, we're changing systems and we're working on it, and I'm studying this. It's like, okay, good. Thank you. So thank you for making this your life's work, and for taking time to be with us today.
Thank you. I really appreciate the opportunity to, again, share my knowledge and just talk to you guys. And this has been so great. And I really appreciate you guys.
Yeah. Thank you. All right. Sounds good. Well, Justin, I'll talk to you soon. And Vaida, thanks again.
Yeah, thank you.
Yeah, thank you.
All right. Bye.
Bye. You've been listening to In Sickness. Find us online at insickness.care or on Instagram at insicknesspodcast. You can send your questions and comments to insicknesspodcast@gmail.com. If you enjoyed the show, please share it with a friend or fellow caregiver, or leave us a review on Apple Podcasts. Thanks for listening, and take care.